Thank you for choosing Tallahassee Memorial HealthCare for your total joint replacement surgery. Our goal is to help you recover from your surgery and reclaim your quality of life as safely and quickly as possible. In this video, we'll share what to expect when you're discharged from the hospital and how to ensure a smooth recovery at home. Before you head home from the OR, your surgical team will take several steps to prevent any complications or disruptions to your healing process and lay the foundation for a successful recovery. It's important for you to continue these efforts at home. Prevention is the key to recovery. In this video, we will focus on 6 areas of prevention: pain, swelling, constipation, blood clots, surgical site infection, and pneumonia. Let's get started. At Tallahassee Memorial HealthCare, we use multiple techniques to help manage your pain. Following your surgery, you will receive both numbing and oral pain medication. Numbing medication will be given either by a single-dose administration directly to the surgical site or by a pain pump. The single-dose numbing medication is placed during your surgery and will help reduce pain for a few days after your procedure without hindering your movement. For some total knee replacements, your surgeon may provide a pain pump for your numbing medication. You'll take the pain pump home with you and use it for 4 to 5 days following your surgery. If your surgeon has spoken to you about using this device, visit our website for further education. In addition to a local anesthetic, your surgeon will provide you an oral medication, such as an opioid, to help with pain management. It takes an average of 45 to 60 minutes for you to feel the effects of an oral pain medication. So your pain control will rely heavily on maintaining a schedule and taking your medication consistently. Don't wait for pain. Stay ahead of it. And remember to always follow your prescription guidelines. Some level of pain following your surgery is unavoidable. Pain management is supported by a realistic goal, so your goal should be to keep it at a tolerable level. Your pain medication and any necessary post-surgery equipment will help you meet that goal. Tolerable pain means you are in pain, but you can still manage your day-to-day activities, such as showering and getting dressed, talking to your loved ones, and performing recreational activities such as reading, doing puzzles, or watching television. Intolerable pain is when your pain is so great it becomes difficult or impossible to perform regular activities like showering and getting dressed. It may lead you to become short-tempered with your loved ones. If you find that your pain is becoming increasingly intolerable following your surgery, please re-evaluate your pain management plan provided to you by your surgical care team and ensure you are following the instructions properly. If you need a refill for your prescription pain medication, you feel you need to discuss your dosage, or your pain level becomes unbearable, please reach out to your surgeon's office. To help control pain and reduce swelling following your total joint replacement surgery, you should perform cold therapy using a cold pack. Knee replacement patients should apply their Jetstream cooling pack to their surgical site 5 times per day for the first 2 weeks following their surgery. Each session should last 1 hour. Hip replacement patients should apply a cold pack to their surgical site 5 times per day for the first 2 weeks following their surgery. Each session should last 20 minutes. Applying a covered cold pack to your surgical area at least 5 times a day for the first 2 weeks following your discharge will help reduce swelling and pain. After the first 2 weeks, you should use your cold pack 2 to 3 times per day as it fits into your schedule for the following 2 to 4 weeks until it's no longer needed. At TMH, total knee replacement patients will receive a special Jetstream cooling pack. While using your Jetstream cooling pack or ice pack, remember to always protect your skin with a washcloth and never sleep while using your cold therapy device. Remember to only use cold therapy for your total joint replacement. Warm therapy is not recommended following your surgery. Total knee patients will also use a special pillow called a leg raiser upper, often referred to as an LRU pillow, to help reduce swelling. This pillow will help raise your knee 20 degrees and keep it straight. While using your LRU pillow, your heel should be just beyond the edge of the pillow. You should use your LRU pillow for about 1 hour at a time for a total of 6 hours a day for the first 2 weeks following your surgery, followed by a few times per day over the next 2 to 4 weeks while you are resting or sitting. Intermittent use of the pillow during the day is best, and it is not required that you sleep with it at night. One side effect of opioid pain medication is constipation. Opiates such as oxycodone, Percocet, or hydrocodone pull fluid away from your bowels and may lead to constipation. Consistency is key when managing constipation. You will need to take a daily stool softener, drink at least 8 cups or 64 ounces of water every day, increase your fiber intake by eating fruits and vegetables, and limit your caffeine. Most importantly, if you haven't had a bowel movement in 48 hours, you should take an over-the-counter laxative and follow the instructions on the package. Your constipation prevention regimen should continue until you have finished taking the prescribed opiates. Blood clots can be a risk after total joint replacement surgery. To help avoid this complication, your surgeon will prescribe an oral blood thinner to take following your surgery. This may be an over-the-counter or prescription medication. Remember to follow your surgeon's instructions on dosage and duration. You should also wear compression stockings to help prevent a blood clot following your surgery. You'll receive compression stockings at the hospital and should wear them on both legs for 6 weeks. Wear them day and night for the first 2 weeks following your surgery, then only in the daytime for the remaining 4 weeks. You can take your stockings off to launder them, to shower, or for an hour at a time if they become uncomfortable. While your surgical care team takes many steps to prevent infection before you ever leave the hospital, it's important that you take precautions to protect your bandage and wound at home too. There are 3 key rules for taking care of your bandage. First, shower only. Do not submerge your bandage in a bathtub, hot tub, pool, or any other body of water. Second, do not put creams, lotions, or powders on or around your bandage. Third, no matter how cute they are, do not sleep with your pet or allow them to come into contact with your bandage. The goal is to keep your bandage on until your follow-up appointment with your surgeon within 10 to 14 days. If your bandage begins to come off or becomes saturated with blood or fluid or damaged before your appointment, please reach out to your surgeon's office for further instruction. Because you're temporarily less active following your total joint replacement surgery, you become more susceptible to developing pneumonia. To reduce your risk of developing pneumonia, your care team will provide you with an incentive spirometer to take home with you. Spirometers assist you in expanding your lungs as you breathe deeply and fully while inhaling from the device. Your goal with your spirometer should be to focus on exercising your lungs for the first full week following your surgery and complete 10 repetitions every hour while awake. You should continue consistent repetitions with your incentive spirometer until you are more active again. If you begin to show any signs of pneumonia, such as persistent coughing, wheezing, shortness of breath, trouble breathing, or chest pain, please consult with your primary care provider as soon as possible or visit the emergency room. While it's unlikely that you'll have a medical emergency related to your recovery, it's important to know how to spot signs of a blood clot or infection. A blood clot can develop anywhere in either leg, including your foot, ankle, calf, thigh, or groin. The location of a blood clot may appear red, swollen, painful, or warm to the touch. Blood clots present differently in each person. If you think you may have a blood clot, err on the side of caution and come to one of our emergency centers immediately. Common signs of infection include a fever greater than 100.5 degrees for 24 hours or more, green-yellow discharge or foul-smelling odor from your incision or bandage, redness and swelling that begins to spread, or an increase in pain. If you have signs of infection in the days following your total joint replacement surgery, please reach out to your surgeon or go to the emergency room as soon as possible. Thank you again for attending our virtual joint replacement class and choosing Tallahassee Memorial HealthCare for your surgery. We're honored to help restore your mobility and get you back to living your life. If you have any further questions about your surgery, please contact your orthopedics nurse navigator. Your navigator is here to help you through every step of your surgery journey, even after you go home. For more information about total joint replacement surgery at TMH, please visit tmh.org/ortho.